Welcome back, everybody, and welcome to our virtual audience. Thank you so much for joining us today for this last day of Mobilize Recovery 2021. Now, while recovery may be a state of mind, we can't do much to support it without understanding what we're really up against. What works, what doesn't work, how our efforts are paying off. Hard data goes a long way in changing people's minds, securing funding for this community, and improving our overall strategies and our tactics, whether it's within our communities or in corporate America. The problem is that the stigma and the systemic bias of addiction is so severe that even people in long-term recovery or people of relative privilege are afraid to contribute to studies or even, quote unquote, go on the record for or about recovery. Yet, we do have some allies who are stepping up today to help fill that gap. I'm excited to introduce virtually Ben Garthwaite. He's the CEO of an organization called the Force Marsh Group, also known as FMG, which is an award-winning B-certified corp that specializes in designing and implementing data collection. Ben is here to join us to tell us a little bit more about how the Force Marsh Group plans to help the recovery movement expand our efforts and make a commitment that's going to help us get the most from the hard work that we put in.
Hi, I'm Ben Garthwaite, an employee and leader at the Force Marsh Group. I want to start by thanking all of you for your work to break stigma and advance recovery from substance use disorder. I'm going to tell you two things about our company that are particularly relevant today. We're a research-first firm. Now, research is not all we do, but it is foundational to how we approach every challenge. Second, we're a certified B Corp. That means we believe that we are all interdependent and thus responsible to each other and future generations. And we believe that to tackle the tough challenges, it's not just up to government, academia, nonprofits. Business has an important role to play. And we believe and are committed to our business being used as a force for good. So that's how we show up as a company. And the research and the data on the number of people living in recovery from SUD and the shortage of resources towards research and services and the infrastructure for recovery is undeniable. And given that data, we were moved to action several years ago and have invested to bolster, center, amplify, and sponsor existing efforts from those of you already in the field, hard at work in the recovery community. Now, concurrent to those efforts, which aim to address issues at a more systemic level, nationally, we can't help but ask ourselves, what else can we do within our firm? And in my humble opinion, this is an important question for all business leaders. We have so much influence over the policies, the benefits, the culture of the workplace where people spend so much time. Are we as business leaders doing enough? Now, to answer that, we think best to turn to research. It is my absolute pleasure to release today our first wave of an annual survey that will gather data on how the workplace supports people in recovery. The survey was conducted earlier this week among a sample of 1,000 nationally representative Americans. And I'm going to share with you a few key findings from the study, which we find both shocking and hopeful. Point one, stigma persists in a major way among those in recovery. 70% of people in recovery felt they wouldn't be hired if they mentioned their substance history in a job interview. 61% of people in recovery are worried about other people finding out about their substance use history. Point two, stigma is also clearly recognized by those who are not in recovery. 81% agreed that most employers will be cautious of hiring someone who has been treated for substance use. And another 67% agree that most people think less of a person who has been in treatment for substance use. Third point, employers, business leaders have a role to play in recovery. 93% said it's important for employers to support their substance use recovery programs for employees. Within that group, 64% stated that it is very or extremely important. 89% said it's important for employers to provide coverage within their employee benefits programs. And our final point here, consumers are looking to brands to support recovery. 92% said they are likely to purchase from a brand that supports addiction recovery, and 94% would support a company that openly supports addiction recovery. The data in this survey is a call to action for all employers. Business leaders can make a difference by making changes within their own organization. And this applies to me. As CEO of a company with close to 400 employees, not a day goes by that I'm not thinking about how we can best support our staff, how we can put people first. And for some of those people, their first steps in their recovery journey will be taken while they're an employee of Fords Marsh. That puts us in a position of tremendous responsibility. And also tremendous opportunity. An opportunity to be there for them with the support they need when they need it most. And to make sure that we are prepared to meet each of those moments when they occur, we've developed a radical new workplace SUD policy centered around creating a safe space for anyone struggling with SUD so they can get the support they need in a stigma-free, compassionate environment. As part of this workplace-supported recovery program, we meet every employee where they are on their journey. If we help them find treatment, recovery programs that work for their unique situation, that can mean taking leave to focus on recovery or continuing to work while seeking treatment. And our commitment to breaking the stigma of alcohol and substance use disorder extends to every employee in our company. We know 9% of all adults currently face alcohol or SUD, and a relatively equal number of people are in recovery. So this is something that will touch us all at some point, whether it's our managers, our employees, or our coworkers. So also built into a policy, we will educate our workforce on SUD and specifically recovery, train all supervisors on how to best support employees from diagnosis through full recovery, provide as part of our benefits coverage, recovery coaching for all employees who need it and employee who wants it. And we'll offer education and support for family members, whether they're dependents or not. This is a bold program, radically different than what is in place at other companies across this country, but it shouldn't be, and it doesn't have to be. In the days ahead, we'll be publishing the full survey results, which are a clear call to action for all business leaders. And to help with that action, we'll also share our work and our learning and our policy and benefits offering to model what a company can do to address stigma and provide their employees with the support and tools to find the power, health, and happiness that recovery can offer. Now, thank you for allowing me to add our work and our commitment to the amazing efforts that you all lead in your communities every day.
So, I mean, that type of stuff actually gets me really excited, right? I mean, that was a major commitment by FMG that we're excited about. We're excited at Mobilize Recovery to partner with them on this landmark study that they just completed. But as you heard from Ben, this is something they're going to continue doing on an annual basis. So we'll continue to track this progress closely, and want to thank FMG and Ben Garthwaite individually for making that commitment here today at Mobilize Recovery. So I am excited, and you all knew when we walked into this that This is what they call a hybrid, where it's virtual and it's in person, and we're heading into kind of a mix of both. Joining us in a few moments is the acting director of the White House Office of National Drug Control Policy and a good friend of this community's Regina LaBelle. And this is kind of a big deal for us at Mobilize. Before Regina offers her message, I just want to take a moment and say thank you to the many administration officials who are joining us today on this final day of Mobilize here in person. They have been in the trenches with us. They know how important this work is. Many of them are in recovery themselves. I don't know if he's in here. He's right there. Everybody give it up for Tom Coderre, who's sitting over there, by the way. You know, I want to thank all of them, but a real special shout out to Tom, who got on the front lines to help fight for this 10% recovery support set aside that is in the president's FY22 budget. And a thank you to the acting director, Regina LaBelle, for really, showing up and supporting this community where it really mattered. We know that this funding is going to be transformational, and moving forward, it's going to be up to us as advocates, as activists, as people in our local communities to fight to make sure it's a sustainable stream of funding that will be in place for years to come. I want to give a few highlights of the Biden administration's year one priorities, and they've made these very clear. Expanding access to evidence-based treatment, advancing racial equity issues in their approach to drug policy, and enhancing evidence-based harm reduction efforts, supporting prevention efforts to reduce youth substance use, reducing the supply of illicit substances, advancing recovery-friendly workplaces, which has been a very common theme here this weekend, and expanding access to recovery support services and peer services. And that's something that really excites me. So please help me and us welcome the Acting Director of the White House Office of National Drug Control Policy, Regina LaBelle.
Hello, Las Vegas, and everyone online. I understand there are about 1,000 people online for today's event and hundreds in person in Vegas. I know how hard all the organizers and partners work to make this weekend possible. So thank you to the entire Mobilized Recovery community for everything you're doing. I wish we could be together today, but I'm so glad we have a way to recognize the importance of the recovery community. I looked over the agenda for this weekend, and I'm really impressed with your thoughtful plan that's focused on building capacity and growing the influence of the recovery community. During the COVID-19 pandemic, the recovery community has been a model of resilience and a lesson on the meaning of community. You've worked to not just sustain a thriving community, but expand it, both nationally and internationally. As we all know, recovery takes place in communities and addiction thrives in isolation. What you've accomplished in the midst of an ongoing pandemic is remarkable. You've created a virtual recovery community that spans geography, race, ethnicity, culture, and age. A virtual web of support at a time when it's urgently needed. And you've made it possible for countless people to enter and sustain recovery when some policies can make that particularly challenging. We all win when people in recovery are able to fully rejoin and contribute to their communities and nations. So thank you. The work before us, however, remains challenging. We all know the statistics, how many lives have been lost to addiction. And behind these numbers are friends, family members, neighbors. We have work to do to make sure everyone with a substance use disorder has a chance at recovery. So we're focused on doing just that. And I'm so pleased to be working with colleagues in recovery who are making a tremendous impact on the Biden-Harris administration's work. There are also 2 cabinet secretaries in recovery, and you'll be hearing from one later today. Leaders in President Biden's cabinet, like Secretary Walsh and others, are working every day to help break the stigma surrounding substance use disorder so more people will be able to get the help they need and achieve recovery. And we know the important role peers can play in recovery. That's why the Biden-Harris administration is committed to expanding the nation's peer recovery support services infrastructure. In the President's 2022 budget request to Congress, he proposed increasing the Substance Abuse Prevention and Treatment Block Grant by 84%, for a total of $3.5 billion. And for the first time, this block grant includes a 10% set aside for recovery support services. This is a big deal and would provide ongoing funding for vital peer recovery support services. The issue is currently before Congress, so there's still time to let your voice be heard. The voices of the millions of people in recovery can make a huge difference on this and other issues. The administration is also looking to expand employment opportunities, including for people in recovery, and encourage workplace policies to support those in recovery and create environments where people with substance use disorder can seek help. Finally, the administration is working to address inequity across our nation, and that's reflected in this year's National Recovery Month theme. Recovery is for everyone, every person, every family, every community. This theme was also reflected in President Biden's National Recovery Month proclamation, from which I'll share a few lines. President Biden wrote, "My administration honors the many pathways to recovery and will support individuals and their families at every step along their journey in whatever form it takes. Everyone can support and encourage those working toward recovery. Helping those in recovery to attain economic opportunity and mobility will not only improve their well-being, but also benefit our nation as a whole. When we make supports and services available to everyone and embrace those seeking to rejoin and contribute to our communities, we make recovery available for more people. And when we welcome Americans in recovery into our schools, homes, and workplaces with open arms, our nation becomes stronger, healthier, and more inclusive. Everyone on our team and throughout the Biden-Harris administration who are in recovery are living proof of this. And your involvement with today's recovery event helps make that happen. We all have a role to play in making sure harm reduction, treatment, and recovery services are available so more people can celebrate recovery. I'd like to close by sharing what President Biden said earlier this year. The addiction crisis has already taken so much, and I grieve with all those who have lost someone. We also celebrate those who are recovering. We hold them in our hearts and commit ourselves to helping more families know the joy and relief of recovery. So celebrate today. Thank you for being so active in helping more people know the joy and relief of recovery. And please keep working to help more people reach recovery and build healthier lives. On behalf of the Biden-Harris administration, I'm thrilled to wish you all a happy and successful Recovery Month.
Welcome back. Thank the Biden-Harris administration. I think we should take a pause for a minute just to reflect that not only, as Acting Director LaBelle mentioned, that we have people in recovery in the administration, President Biden has also publicly talked about somebody very close to him, his own son, and that is this pretty special moment for the recovery community that his own son is out there talking about recovery. One piece that I've had a privilege throughout my advocacy career is I had mentors early on as I got into advocacy and who said, you need to go back to school. You need to study the policy. If you're interested in changing stuff, you need to figure out where the money comes from, right? If we want to change policy, we invest in what we value. We buy what we believe in. And for too long, we've been buying the wrong things. You know, I'm not real happy where my tax dollars go. I'm not too thrilled at some of the policies that we have in place. And we're on the cusp of this moment as the opioid epidemic, and we make the front page of the New York Times every other week with these horrific statistics. And as a result of that, people are starting to invest some money. But there's billions and billions of ways to get that wrong. And if we want to get that right, we need to follow the money, we need to understand where it's coming from, and we need to be at the tables that those decisions are making. And so we're really grateful to the next group of people who are going to join me for this discussion to talk a little bit about federal, state, local, and philanthropic investments that are heading your way in your community, looking forward. A lot of things have happened in the past, but we need to figure out what happens from here and how do we access these funds and bring these resources to bear. So it's my privilege and honor to introduce a man who, I don't want to read his bio because he doesn't need an introduction to this community. 12 years ago, I sat in a training and he taught me how to tell my recovery story and told me that we need to go find the drama in recovery. Let's give a round of applause to the Acting Deputy Assistant Secretary for Mental Health and Substance Use, Tom Coderre.
Sit down, sit down. Thank you, everybody. Thank you, Mobilize Recovery. Wow, this is amazing. What an amazing few days it's been for me here. And Greg, wow, last night, totally amazing. Historic, in fact, and so emotional and so powerful for me. Thank you to Ryan, to everyone who has been involved in creating Mobilize Recovery again this year. I got to come in 2019, and I got to come virtually last year, and now being here again in person and just feeling the energy come back, rush into everybody. It's just been so, so amazing. And it's definitely an honor for me. It's an honor of my lifetime, really, to tell you the truth, to have served as the Acting Assistant Secretary and to be the first person in recovery to lead SAMHSA. And while I'm humbled to have been the first, I better not be the last. And by the people I see in this room today and the people I've met over the last few days, I know I won't be the last. I just know I won't. There's been a lot of talk this weekend about standing on the shoulders of those who came before us, right? It's, I never would have been able to do this without leaders from Marty Mann to Marty Walsh and everybody in between. That's whose shoulders we are all standing on today. We never know when the opportunity is going to meet the preparedness, right? We never know. We never know when an opportunity will be presented to us, so it's our job to come to events like this, right? To serve in positions, both volunteered and paid, to take jobs that are just a little bit of a stretch for us, right? So that we can come together and lead, right, when the opportunity meets the preparedness. An opportunity to lead in our local communities, in our states, and even in our federal government. It's incredible, right? Because as a former state senator myself, and as we heard from Lauren Davis last night, and we heard from Courtney Allen in the panel this morning, that's where the magic happens. It happens in the halls of Congress. It happens in the halls of state capitals. It happens in city councils and on local boards, and it happens on your task forces back home. So please continue to do that. Continue to lead wherever you can, and continue to look for the opportunities, because I know you guys are getting prepared for it. Now, I'm here to talk about some boring government stuff. So I have slides to help me out here. And Donna covered this yesterday, but I think it bears repeating. Our new Assistant Secretary at SAMHSA, Dr. Miriam Delphin-Rittman, who sends her love, by the way. She's a former mental health commissioner from Connecticut. Greg, did you have something to do with that? She is a big, big believer in recovery. And as you can tell from the 5 priorities here, which are super important, the 4 core principles, I think, are even more important. And the last one there, recovery, which is going to undergird all the other things that we do at SAMHSA and throughout the federal government, I think are really, really important. And it's what Director LaBelle just talked about, who I've had an incredible partnership with at ONDCP and in the previous administration as well, and the Obama administration, I should say. It was incredible to work with her on so many of these priorities. So these are kind of being carried across the administration for us all. I wanted to talk a little bit about money, as Greg said. In federal budgets, they're pretty complicated, and I only have a couple minutes here, and it's impossible to cover everything. So this slide shows, though, that SAMHSA was appropriated about $6 billion in FY21 for our work. And at the end of December of last year, Congress passed the COVID relief bill, which gave us an additional $4.25 billion to deal with the impact of the pandemic on mental illness and substance use across our country. And you can see how Congress divided it up on this particular slide, right? There's money for suicide prevention, there's money for community behavioral health centers, there's money for youth behavioral health, right? The Children's Mental Health Initiative. But there's two big ones on here, and those are the block grants, the mental health block grant and the substance abuse prevention and treatment block grant. That's where we saw big increases, $1.65 billion to each of those block grants, which was totally incredible. Fast forward to April, the American Rescue Plan passed, right, which added an additional $3.5 billion for the FY21 appropriations. And it raised SAMHSA's initial appropriation, remember I told you it was $6 billion, to $13.8 billion. So finally, we're seeing the kind of resources that are an appropriate response to this crisis in our country. And I'm so excited that Congress has acted and that the President has acted to make that happen. It's really important. The first pot of money I wanted to tell you about, states have 2 years to spend that. This pot of money, states have 5 years to spend. And that creates some logistical concerns, and hopefully we'll cover some of that in the Q&A. And then the final couple of things I wanted to talk about was the President's FY22 budget, because this is really important too. This is how the President divided up the FY22 budget. I'm happy to report that the big increases in the block grant were included in the FY22 budget. So making them permanent, not just COVID relief now, not just American Rescue Plan, but permanent in the block grant, right? The block grant, as Director LaBelle mentioned, was proposed at $3.5 billion. And there was an additional $750 million for the state opioid response grants, bringing that program to $2.3 billion. So lots and lots of money out there. And I know, we're going to talk about how states divvy this up as well, and Dr. Woodward's going to cover some of that. Will the President's budget pass, I think is what a lot of people ask, right? And I have no idea. I do not have a crystal ball. But what I do know is that Congress right now is working on a continuing resolution, which hopefully will pass this week, that will keep the government open and running. And then we'll have until probably December, sometime at the end of December, before we see the President's budget and what is actually contained in it. But there's some really good news. We saw a markup by the House Appropriations Committee, which kept a lot of it intact, which kept the recovery set aside intact. Congratulations to all you advocates out there. Didn't keep the entire block grant increase intact, but it kept $1 billion additional money for the block grant, and it kept $500 million for the SOAR grants. So that's really important. In addition to that, we saw increases in some of our discretionary grants programs, and we can talk about that, but the things that are keeping some of you guys alive out there, like B-Corps and RCSP, the targeted capacity expansion grants that Donna mentioned yesterday. And then we also have our Pierce COE that Donna mentioned, where we've been able to find additional resources to support that, because we know with all the extra work you guys are doing, you're going to need additional TA for that. And then at SAMHSA, we're also making sure that we raise the recovery profile across the government. So Donna's position as a senior advisor for recovery, maybe another little announcement that might be coming later this week about how we're going to infuse recovery into our agency, and then raising the level of recovery across HHS and the entire federal government. And we're going to hear from the Cabinet Secretary, Marty Walsh, a little bit later about how we're doing that. So it's a real honor for me to join you guys here today and to be part of this distinguished panel. Thank you.
Thank you so much, Tom. We're really excited about everything. My pleasure to introduce Dr. Stephanie Woodard, who's the State Mental Health Authority and Single State Authority here in Nevada. She provides oversight and quality assurance to behavioral health providers statewide, designs, plans, funds, and implements systems of care, including behavioral health prevention, early intervention, treatment, and recovery support services, establishes funding priorities for behavioral health services, and supports through their close collaboration with communities and stakeholders, evaluates outcomes of behavioral health interventions, and guides policy and financing options across the Department of Health and Human Services. Please help me welcome Dr. Woodard.
Thank you, Greg, and good morning, everyone. What a wonderful day to be celebrating recovery. So happy to be joining all of you today to have this conversation around emerging funding streams and policy. So as the single state authority for substance abuse treatment and prevention and the state mental health authority for the state of Nevada, I do have an opportunity and an obligation, actually, to evaluate the policies and the way that we use our funding to really move forward what it is that we value. I think Greg said it best, that we invest in the things that we value. And it is important for a state agency to really be able to lead with those values. A little bit about me, I'm also a psychologist. I've worked with families and individuals struggling with mental health and addiction issues for over 20 years. I am also the adult child of a parent who is in long-term recovery. And I've also lost a parent who lost a long-standing battle with trauma and depression and anxiety in 2018. I share with you that part of my personal narrative because I think that it is important to continue to really live out loud and to bring the voices of those who are in recovery and those who have been lost to addiction to the conversation. I also say this because my experience as a state official, but also an individual who has been impacted by addiction, informs what it is that I do every single day. It is through that experience that I also know that it is other elected officials, politicians, city council people, individuals who have the ability to move forward policy and to fund to their values. And it is that shared narrative that helps us continue to further the conversation. We have a time unlike any other time where we have additional dollars that are coming into states and local communities in a way that we've never seen before. Tom had just talked about the infusion of federal funds that the state has received. Here in Nevada, that means that we have had an additional $54 million invested into our state behavioral health system since February. And we have to work very quickly to put those dollars to work and get them into the communities where they can have the greatest amount of impact as quickly and efficiently as possible. We also have an opportunity now with the opioid litigation settlement funds coming to states to shape how those dollars are going to make their way and have the impact that they need. So in Nevada, we are one of 20 states that has had an opportunity to move forward legislation to determine how as a state we are going to direct those dollars. In this past legislative session, we passed Senate Bill 390. I actually had the opportunity to work with a bipartisan legislature to be able to move this policy forward. We used some support through Shatterproof, as well as some of the guiding principles through Johns Hopkins to help to shape our policy and really bring forward the priorities for prevention, harm reduction and overdose prevention, treatment and recovery supports, making sure that we are using evidence-based practices and also investing in emerging practices that demonstrate promise so that we can continue to forge the evidence base that we need to make the impacts that we are all seeking. One of the most important components to the legislation that we passed in Nevada was we started a resilience committee. We actually start our first meeting next week. And this resilience committee, you will not find one elected official on the committee. We specifically and intentionally crafted the membership of this committee to bring forward individuals with lived experience, to make sure that we had statewide representation from frontier and rural communities as well as those that are urban. We wanted representation from communities that have been disproportionately impacted by substance use and opioid use so that we could include those voices as we formulate how we are going to use these dollars at the state level. This also includes a needs assessment. And it's not just data. We absolutely use data to drive our decisions and to guide policy, but it's going into the communities and using methods like community-based participatory research, talking to people who have been impacted, talking to individuals who currently use drugs and are engaging in harm reduction to make sure that we are not developing policies and programs that could almost do harm. We want to figure out what's working and what's not working, what's broken, so we can use these dollars to fix our broken system. We're also making sure that our Resilience Committee can help not only guide the needs assessment, but to establish the priorities and then set the state plan for how the allocation of those funds will be able to move forward. Our state is currently within 62 different separate settlement litigations. So we know that these dollars will be coming into our state for quite some time, and we want to make sure that we get them to the community where they can have the greatest amount of impact as quickly as possible, while making sure that the voices of individuals who have been impacted by this crisis are heard and are really being used to lead the way and guide us through. I'm looking forward to the continued conversation, and I think we have one more panelist to come up.
Wow. Thank you. Thank you. Wow, what if all of our SSAs sounded like that? Woo! Unbelievable. We got work to do. It's my pleasure to invite Dr. Andrea Barthwell to the stage to join us. She is a certified addiction specialist and served as the deputy director for the Office of Demand Reduction at the Office of National Drug Control Policy under President George W. Bush from 2002 to 2004. She served as a past president of ASAM, the American Society of Addiction Medicine, and currently now serves as the board chair of the FOR Foundation, which just received a $100 million endowment. Welcome to the stage, Dr. Andrea Barthwell.
Many of the things that I was going to say have been said. So I'm going to tell you a little bit about what my beliefs are so you can understand what my comments to the questions are based on. Drug use is a preventable behavior, and addiction is a fundamental yet treatable disease of the brain. Only about 19% of people who need treatment get there. About 25 to 30% of them who have a treatment episode achieve what's necessary after treatment, which is to acknowledge addiction, commit to recovery, and reduce or eliminate inducements to use. If those three things are not achieved, if one uses drugs after treatment, it's not a relapse, it's continued use. Relapses are driven not by biological symptoms, but by cues and stress. Craving is an opportunistic disease. If there is a chance that the craving can be satisfied with drug use, the craving is more likely to occur more intensely and more likely to drive that drug use. Imagine someone who's been locked up in jail, and let's assume for a minute he can't get drugs in jail, who gets out, right? Who gets out completely detoxed, walks home down the street where he used to cop his drugs, and suddenly, without having physiological need to use again, he experiences intense craving as he walks by his drug dealer's house, where whenever he presented himself there in the past, he either was anticipating withdrawal or was in withdrawal. So opportunistic is a craving disease that has to be managed. We know a lot about preventing drug use. We don't do a very good job of it. We know a lot about treating addiction. We do a horrible job of it. Some people get better treatment than others. Some treatment is better than none. More treatment is better than less, but treatment is best when it's driven by assessment, buttressed with case management, and completed with follow-up care in the community. What we have to do is to make sure that these dollars that are coming into our states get to people who need it, and we build on the infrastructure that's already there to make that infrastructure serve our needs better. So I'm going to tell you a little bit about that in the minute I have left. The 1990s tobacco settlements prove that commitment and planning are necessary to ensure that the proceeds of the opioid litigation go toward substance use and misuse. We need to prevent, treat, care for current drug users, and we need recovery support. And when I talk about treatment, I talk about drug dependence treatment, which leads to those three outcomes: commitment, acknowledgement, commitment, and action, and also drug dependence care. Many of you refer to that as harm reduction, keeping somebody alive until they can make a decision or a commitment to do something more in depth to change the fundamental aspects of their lives. To date, it appears that the settlement agreements are limiting the use of proceeds to addressing opioid use disorder and those co-occurring substance use disorders and mental health disorders. And in light of the previous substance use, which is the norm among opioid users, we cannot make them substance specific. We have to make sure that the treatment is provided to anyone with a substance use disorder. For this reason and several others, public health experts and activists recommend that states enact opioid litigation proceeds law. The core provisions of these laws include what I call the 5 cardinal rules. Separate opioid litigation proceeds from the general budget and the GRF. We saw tobacco build roads in Illinois. Address all problematic substance use, supplement, not replace existing funds, empower public health and medical experts and persons with addiction and recovery experience to make funding decisions, and transparency. This weekend, the O'Neill Institute, while we've been here, the O'Neill Institute at Georgetown Law and the Legislative Analysis and Public Policy Association and the Center for U.S. Policy drafted model opioid litigation proceeds laws that contains the core provisions, or those 5 cardinal rules. This was a part of a 2-day conference. You can find their report will be online on September 30th, and it represents consensus among a number of people in law, policy, and addiction medicine. What you can do is to encourage your state legislators to look at these policies or others of your choosings, but to make sure that the funds get where they need to be. And my time's up. I'm going to have more to say about what FOR is doing to make sure that the gaps between federal funding and what's needed are met with philanthropic dollars. And I wanted to tell, Tom is a real colleague of mine who is openly in recovery. We had a lot of people who were in government who were not openly in recovery. When I joined Bush II, I was the first person to go through a Senate confirmation who was in recovery. And they wanted to read my drug use FBI background search, drug use history on the floor of the Senate as a condition of my confirmation, but better minds prevailed, and I was finally confirmed. So thank you. It's a pleasure to be here with you.
Well, thank you, Dr. Barthwell. And so we're going to have a little conversation about how do we access these funds.
That has been crazy.
And I know that more than one of you have called Tom Coderre over the last couple months or years and said, Tom, you know, I got this RCO or I got this idea in my community. Can you send me a check? And unfortunately, the regulations don't work like that. So can you explain to us how these billions of dollars, there was a lot of zeros on your slides, how does that get down to the community doing this work?
That's a great question, Greg, and I do get a lot of those calls. Thank you guys for calling, and I'm sorry that I can't send a check. Everyone thinks I'm going to pull up my car and open up the trunk and pour out bags of money, and that's not how federal grants work. We have 2 categories primarily. We have formula grants and we have discretionary grants. And our formula-based grants are the block grants and things like SOAR. Those dollars, Congress has directed us to send those to the states. So we send them to you. We send them to all the single state agencies. We have, I think, 57 jurisdictions that receive funds from SAMHSA through that vehicle. And then the state is required to create, do a needs assessment and then create a state plan. So the states create these state plans, they submit them back to SAMHSA. We check them, you know, check all the boxes, make sure that all the things they want to do are allowable uses, and we give them approval. And then the state is then tasked with giving those monies out. And we can talk a little bit about, I'm sure Stephanie has some things to say about this, because at the state level, they have a whole process themselves that they have to go through. The second category of funding is discretionary grant programs, and those are, many of you have applied for either a B Corps or an RCSP. That's a discretionary grant. SAMHSA has tons of them. In fact, not only does SAMHSA have them, but my friend David was mentioning to me earlier about HUD, which has 20 in 26 states a recovery housing grant. CDC has new funding that they've released recently, $950 million, co-op that funds 66 states and local jurisdictions for overdose prevention surveillance. There's a lot of these discretionary grant programs out. You can apply directly to SAMHSA for these grant dollars. You have to fill out, we've done the best we can at streamlining the application process. I think we're down to 10 pages now for a SAMHSA grant, and I know that doesn't seem, maybe doesn't seem like a lot to the federal government, but is to a lot of organizations who maybe are applying for these dollars for the first time. So we have seminars about how to write a competitive grant proposal, workshops where we'll work one-on-one with you as well if you need some help in trying to write a grant to receive SAMHSA dollars. So thanks for all the calls, but go on grants.gov or samhsa.gov/grants, and you can see a list of all of our funding opportunity announcements, what the deadlines are for application, and how to kind of get some resources out to the community to fund the amazing work you're doing.
Awesome, thank you. And so the money starts at Congress, comes to SAMHSA, SAMHSA sends it down to the states, and then Dr. Woodard, your department gets to kind of determine priorities of what gets on the ground. And so you talked a little bit about some of the strategies you've deployed here. How have some of those decisions been made, and how have you involved people with lived experience in those decisions?
Great question. So as Tom had mentioned, the states through the block grants are usually infused dollars. We just received some supplemental funding, and the supplemental funding, quite frankly, came a lot faster than we were prepared to be able to catch it and be able to get it out into the community. So we actually hit pause and decided that we needed to reevaluate our needs assessment. So all states have needs assessments and state plans that identify what the needs and the gaps are, what the assets in the community are, and then how we're going to use existing funding to make sure that we can really fund to the gaps. One of the issues that we've had ongoing with the block grants, and I'm happy to hear that they may be able to extend some of the funding through the supplemental, is that the block grants in and of themselves are necessary but not sufficient funding to not only stand up but maintain an entire system of care as it relates to behavioral health. And so we have to make a lot happen with a little bit of funding. And the best way that we tend to do that in Nevada is to use those dollars to both stabilize services that for no other payer is available. So residential treatment services, for example, withdrawal management, and transitional housing. We're fortunate that we then also work with our state Medicaid agency so that we can bring proof of concept to them and provide them the support that they need. So we're actually in the process right now in Nevada exploring an 1115 demonstration waiver so that we can make federal participation and be able to draw down federal dollars to continue to provide residential treatment and withdrawal management services in the community. Our hope is then that that frees up some of those federal dollars so that we can invest other ways. The other way that we use those dollars is to invest in standing up programs with an eye towards sustainability, and we do this across all of our funding streams. So we do this with our state opioid response grant dollars, as well as our block grant dollars, and other dollars that we're able to make use of. This way we can stand up programs, get them to a place where they're solid and independent, move them on to sustainable funding streams, and then invest in additional programs to bring them up. It's a lot of work. It requires a lot of coordination, a lot of community input. We're fortunate in Nevada that we have Foundation for Recovery, which is our statewide recovery community. And we work with them as well as our treatment providers, our prevention coalitions, and really try to bring in as much information as possible to help guide the development of our state plans. In anticipation that as additional dollars come down, we can make use of those dollars, knowing that we've already got a state plan that has been endorsed and advocated for, so that we can direct the dollars where they need to go.
Thank you. it's, you know, it's awesome to be able to include so many people like in the process, right? But sometimes, you know, in an emergency and in a pandemic, you know, including all those people that government employees need to include sometimes, you know, creates some lag and some problems that we don't have. Dr. Barthwell, you know, one of the biggest frustrations that I've had in my work in this field has been the lack of private philanthropy, the lack of you know, emergency funding, given the scale and size of this problem, right? Where you look at a lot of other issues, social ills that impact the United States, and they have hundreds and hundreds and hundreds of millions of dollars in private philanthropy responding. Can you talk a little bit about, you know, some of the challenges around getting private philanthropy, and then some of the opportunities private philanthropy has to respond to these issues and fill some gaps?
Yes, thank you. There have been a few philanthropic groups that have focused on this area over time, but just a few. And, you know, we've always wondered, why don't we have an American Cancer Society-like organization? And we were hoping that Shatterproof will help us get there. That was one of the reasons many of us supported Shatterproof in the beginning. Support a guild of people in recovery who want to, you know, bring this out of the shadows. But we've had Robert Wood Johnson and the Kellogg Foundation and J&J. There have been others who've put money into it, but their issues have been very narrow and categorical, pregnant and parenting women, and nothing really broad. So we got $100 million from McKesson to start the FOR Foundation. And you can imagine we don't have as many zeros as Tom. So we have to be very careful with what we do. Now, in the 3 years of our existence, we've grown that $100 million to $150 million. And you can see our last audit on our webpage. We wanted to be very open about it because we did get money from McKesson, not as part of settlement. McKesson wanted to get ahead of the settlement things and to really make a contribution to this area. But because no one gives you $100 million without wanting to make sure that you're going to be good stewards of it, we had individuals who came from McKesson who were on our board. And in order to make sure that McKesson didn't influence what we would do, we had to spend time developing a board. We've done that. We have now funded 45 grants and spent $13.2 million. We've had 4 categories of grants come out. The first was on access to treatment. The second was on some COVID expansion funds because our grantees were trying to work in the middle of COVID. And since we had put an emphasis on people in recovery and recovery workers, knowing that they were continuing to be frontline, like the cashier at 7-Eleven, we wanted to make sure that they were getting some protections, and we focused our money on finding ways to protect them because they were still doing all the outreach while the higher-ups got to stay at home and Zoom in. Our third category was engaging families and communities on the whole prevention effort. And our fourth now are innovative grants, and we're looking at professional education, data, trying to get our arms around the data. And we've created a process where you write a small concept paper, because we don't want you to have to go through a lot of trouble if we're not going to fund you. And the concept paper, from that you get invited to write a more fulsome grant to us. So we're trying to make it as streamlined as possible, but we are very deliberate in trying to deal with the mortar, things that Tom can't fund, to put the mortar out there to Tom's bricks. So mostly it's going to people who are getting Tom's money or Dr. Woodard's money, but they couldn't do something because of the way in which those funds are restricted. So we're asking them to do things that the government wouldn't normally allow them to do with the money so that they can have a greater reach with a real emphasis on recovery and prevention.
Thank you. And we're running a little long here, so I do want Dr. Woodard just to talk a little bit about the opioid litigation legislation that you were able to help push through Nevada, because I know it's something that many of the states might want to copy, and then Tom, I'll give you the last word to close us out this morning. But if you want to tell us in a couple of minutes just about the litigation or the legislation that you were able to pass at the state level.
So it was really a partnership between the Attorney General's office and the state legislature and the Department of Health and Human Services to really come together and figure out how we were going to formulate the legislation to allow us to do the most that we could to have the greatest amount of impact with that funding. So the first was really having a legislative champion. Senator Julia Ratty has chaired the Senate Committee on Health and Human Services in Nevada, and she had a bill that was going to be able to be a vehicle for this legislation. She's been a huge champion for behavioral health in general and really took this on with a great deal of seriousness. We also, in the same bill, actually included the crisis response account, which is another piece of legislation that many states are formulating right now as well around developing a fund and a funding stream for 988, or the 911 version for behavioral health. So this was a huge bill. And oftentimes in state legislatures, really big bills that are trying to do too much too fast immediately get stopped. But because we had already sown a lot of the seeds as it related to 988, but also many individuals in the legislature were acutely aware of the impacts of the opioid epidemic, we were able to get some pretty good buy-in. I will say that there were certainly struggles. One of them was we were also facing a massive budget shortfall because here in Las Vegas, this is really the economic engine of Nevada, and due to COVID, Las Vegas, the lights went out. People were not coming, planes were not flying. And so because we generate the majority of our tax base on tourism, we were facing a budget crisis. And of course, there was a look from our finance committees to see, could they leverage any of these opioid settlement litigation dollars to help to fill some of the gaps within our budget? But because we had such a strong understanding and strong champions in the legislature, that was not allowed to go forward. And we were able to carry SB 390 to the finish line.
Awesome.
I will also add that, you know, the voices of advocates and advocacy is so vitally important to this process because, you know, I am a member of the executive branch. There's only so much that I can do when it comes to legislation. Typically, it's about education, but I do not advocate. I cannot advocate. It is contrary to my role. So having people from the outside really be able to join with legislatures, have the conversations that must be had, help to provide a lot more information. And that advocacy, I think, is crucially important to seeing some of this legislation move forward.
Thank you. And if you need help with getting this kind of law in your state, you know, reach out to Aaron, reach out to Garrett, Ryan, and they can pass on the legislation. So we need that kind of legislation in all the states as this money flows. And so Tom, with the moment before us, you know, you've been doing this work a long time. A lot of people are just starting this work. Some people have been doing this work for a long time. Never before we had this kind of moment. What's your closing thought to this group right now as people try to engage in not getting it wrong?
The pressure's on, Greg. The pressure's on, not only for me, but for you guys, obviously, with a question like that. You know, Bill White told us to go make some history, right? And that's what I've been trying to do for the last 15 years that I've been involved in this work. Working with Pat Taylor, working with Tom Hill, working with others, like now being in government and being in a position to be able to affect change, not advocate, but policy make, right? We can do policy making in government. And so that's how the 10% set aside came about. You know, for years and years and years, we all talked about it, and then all of a sudden we were in a position to make policy. And so, you know, I said to Tom Hill when we both got appointed this time around, I said, last time around, Tom, we weren't able to do this. This time around, we need to do it. So my advice to all of you, and my charge, I guess, and challenge to all of you, is to go find that place. Go find that place where you can make that change happen, because it is within each one of us. I didn't believe it at certain points of time. I remember one of the speakers up here earlier this week, talked about having like a crisis of confidence. I have those frequently, and I know you guys do too. You think maybe you don't know enough, or you're not good enough, or you can't get the ball across the finish line. I'm here to tell you that's not true. That those are lies we tell ourselves. And I really challenge you and encourage you to push yourself beyond what you think is possible, because this is that opportunity moment for us. This is that opportunity moment for our field. People are paying attention and people want to help. So go out there and make some history.
Well, thank you all, and I'm really excited. We're about to make some history right here, right now. So let me bring up Ryan Hampton to make some history on the stage of Mobilize Recovery.